Hey everybody, I hope you are currently enjoying your spring break and hopefully getting to do something fun. So I'm going to very quickly do a voiceover today about the adaptations to aerobic and anaerobic training in the body. This you need to have kind of more of a working understanding of than necessarily the minutia. So I'm going to kind of go quickly in certain areas and kind of dig in more in others. So with that said, let's get started. So, what are we going to cover today? So, obviously, we'll talk about the adaptations to aerobic and anaerobic training. We will also get specific into high intensity interval training, and then the concept of specificity of training and when we would want to do more specific styles of training versus cross training. So, these things you should kind of know already. So when we train our cardiovascular system, we are trying to build up what we refer to as cardiorespiratory endurance. By definition, this is the ability to sustain a prolonged dynamic exercise at the given intensity that I would like to complete it at. If I want to actually improve my cardiorespiratory endurance, I'm going to have some multi-system adaptations. That means my cardiovascular system, my respiratory system, my muscular system, and my metabolic functioning, whether I'm using my PCR system, glycolytic system, or aerobic system, are all going to have to work together to adapt to in order to have a better performance. A few different ways we know this works. If I can increase my maximal endurance capacity, we usually can measure this by seeing an increase in somebody's VO2 max, either through lab testing or through field testing. And we will also see an increase in their submaximal endurance capacity. This means at a given intensity of exercise that is below my maximal effort, I'm going to have a lower heart rate than before I started training. This is especially important when I'm dealing with competitive endurance performance. So distance runners, soccer players, things like that. So in this particular example here, we have an individual with the blue that is before going through a training program, and red is post-training. So we can see that there was an overall increase from, let's say, about 45 mLs per kg per minute to about, we'll call it 58 mLs per kg per minute in VO2 max. So clearly there has been a large increase in this individual's performance, but also because their VO2 max increased, their ability to go at an increased speed was also there. So the major adaptations to aerobic training. When we're looking at the cardiovascular system, typically we will see an increase in the heart size, particularly at the left ventricle. So exercise-induced left ventricular hypertrophy. You will also see an increase in stroke volume because these individuals can more effectively pump out blood with each heartbeat, again, due to that left ventricular hypertrophy. We will see a decrease in resting heart rate and more efficiency at a given submaximal heart rate. We will see an increase in cardiac output, more efficient blood flow, a better maintenance of blood volume, and an increase in our red blood cell volume, specifically increasing the hematocrit so we can carry oxygen more efficiently. So, what this actually looks like. We've kind of talked about the Fick equation before. So this is using stroke volume, heart rate, and the AVO2 difference to calculate somebody's VO2. But we've also discussed finding a true AVO2 difference can be incredibly invasive, as well as a true stroke volume. So we kind of have to make some assumptions here with the Fick equation. Therefore, when we see our increases in our VO2 max, we have to kind of assume that there was an increase in the maximal stroke volume, and we have to kind of assume there is an increase in the maximal AVO2 difference, so we are becoming more efficient and pulling oxygen out of our blood. All right, so looking at heart size, So we know with training, we can increase the heart's mass and the left ventricular volume. This is because we are having specific cardiac hypertrophy, which is going to allow us to increase our stroke volume. Also, if our increases in our plasma volume because we are more efficient at maintaining hydration and blood volume, this is also going to increase our left ventricular volume and our end diastolic volume, and therefore our stroke volume. So we can kind of see that all of these characters are going to kind of play nice together to improve the heart size and therefore our cardiovascular function. So looking here, we have a comparison in runners, cyclists, and strength athletes. So we can see individuals that go through training cycles, be it runners, cyclists, and strength athletes. You're going to get the most change in individuals that do high amounts of cardiovascular activity. And in this situation, we can see the largest changes occurring in the cyclists, the next largest in the runners, and the smallest amount in the strength athletes. This makes sense. All right, so digging a little bit more into stroke volume, we know it's going to increase after we do some sort of training. We're also going to have increases at rest, submaximal effort, and maximal effort. Again, that is because our plasma volume increases with training, so we have increases in end diastolic volume, therefore I have an increase in preload. We know that when this ventricle is going to stretch due to preload, it is going to make my contraction much more forceful when we actually do get to contraction. We also know that our resting and our submaximal heart rate are going to decrease with training. This means we're going to have more time to fill the heart, which will also increase our end diastolic volume. Also, we know we're having increases in left ventricular mass with training, so we have more force of contraction. We also have some attenuation with our pressure with training, so we have decreases in afterload. So basically, we have more stretch in the heart, more blood is filling the space, and we're more efficiently pumping this blood out of the left ventricle. That means that stroke volume is increasing because we train better. This is going to work up until a certain point. So these big adaptations in stroke volume are actually going to decrease with age. So training a young, healthy 20-year-old and training an older, healthy, say 50 or 60-year-old, even though the trainee is still going to show increases in stroke volume, we're going to have much larger adaptations with the younger individual as opposed to the older individual. All right, so we can see these changes in stroke volume in pre-training versus post-training. So we can see after training at the various treadmill speeds, stroke volume increases. All right, so, and then if you are more table inclined, this basically will give you the same amount of data that the previous graph did here. So other cardiovascular adaptations, we know resting heart rate tends to decrease. A good way to think about this is you'll see about a drop of 1 beat per minute per week of training. So if I want to see a 10 beat per minute drop, say somebody has a resting heart rate of around 70, we want to get them down to around 60. That's going to take about 10 weeks of training. All right, and this works because we have an increase in our parasympathetic tone and a decrease in our sympathetic activity of the heart. Our heart is becoming much more efficient. We also know submaximal effort will have a decrease in our heart rate for the same given absolute intensity. Usually if you're just going for like a light walk around the neighborhood, this is not very noticeable. However, when we get to higher submaximal intensities, so say not an all-out effort, but trying to, run a 5K, we tend to see more changes here. And then we know maximal heart rate tends to kind of stay the same even when you train, and it's still going to decline with age. But basically, because we're having a lower resting heart rate and a lower submaximal heart rate at a given intensity, I can do more work with the same maximal heart rate. Right, so here is another example of kind of this theory in action. So we have pre-training in blue and post-training in red. We notice in both of these cases, there is still a maximal heart rate for this individual, somewhere around, we will call it 190-ish beats per minute. But you can see that at each of the given treadmill speeds, so for example, if you look here at the 10 kilometers per hour, specifically in this region, you can see the heart rate before training was about 125 beats per minute, and then after training is probably chilling somewhere around 105 to 110 beats per minute. In terms of longevity and doing performance, that's going to make a big difference, especially when we're talking about substrate utilization. All right, so going into this, we know there's an interaction between heart rate and stroke volume. This is our Q, or our cardiac output. So this is kind of an interesting question. Does the decrease in heart rate necessarily automatically mean I'm going to have an increase in stroke volume? And does an increase in stroke volume necessarily mean I'm going to have a decline in heart rate? Yes and no. So heart rate and stroke volume are going to be constantly interacting with each other to optimize cardiac output. So say if I have a larger stroke volume, but I'm needing more demand, my heart rate may not necessarily drop to meet that. So a good example here would be, say, a power lifter that deals with high amounts of blood pressure changes. They're going to have adaptations in stroke volume, but not necessarily get the decline in resting heart rate benefits. That is an optimal cardiac output for that individual. However, a distance runner, we're going to see a lot more one-to-one exchange with an increase in stroke volume leading to a direct change in decline of a resting heart rate. In terms of heart rate recovery, the more fit you are and the better you train, the faster your heart rate recovers to resting. This is kind of a good indirect index of cardiorespiratory fitness. So if you can remember when we did the YMCA step test, that was totally assessing heart rate recovery. We weren't looking at distance, we weren't doing a true assessment of anybody's VO2, hooking you up to a CosMed cart and sending you for a run. But I can kind of assess an estimate of somebody's fitness or level of training just based on how fast their heart rate recovers. And then we know that cardiac output, we see little to no change at rest and submaximal exercise, even when you train. Most of our changes in cardiac output are going to be at the maximal level, and this is due to the considerable changes and increases in stroke volume. So you've seen something like this before. We have heart rate, we bring you up to maximal, to a heart rate max, and then we let you recover. So we can see pre-training, this recovery was much slower, and then with post-training, it was much faster. Here, we can see changes in cardiac output. Again, you're kind of tracking cardiac output at our various treadmill speeds, but due to increases in stroke volume and general fitness, you can get more cardiac output and higher treadmill speeds. So, other cardiovascular adaptations. You will see an increase in blood flow to our active muscles. Blood is traveling much more efficiently. We have appropriate plasma volume. Lots of different interactions are occurring to make sure our muscles get appropriate oxygen and nutrients and offload any metabolic wastes and CO2. We're also going to typically see an increase in capillarization and capillary recruitment. So we tend to increase the capillary to fiber ratio. That means there is more opportunity for these fibers to interact with capillaries and blood. And then we also tend to increase the entire cross-sectional area for capillary exchange, again, allowing more opportunities for capillaries and blood to interact with the working fibers. We also see more effective shunting or decreasing blood flow to our inactive regions. So again, if I'm participating in rigorous physical activity, I don't necessarily care about digesting my hamburger that I just ate. Also, probably don't eat a hamburger before doing physical activity, but you kind of get the idea. We also see an increase in total blood volume. Basically, this is going to kind of compensate for decreases in venous return as a result of more blood hanging out in the capillaries. All right, so this is a nice little summary slide of everything we just talked about. So if you were more table inclined, you may look here. All right, further adaptations, blood pressure. We know that we will have a decrease in blood pressure changes at a given submaximal intensity. Basically, we know that there is still going to be an increase in systolic blood pressure and either staying the same or a slight decrease in diastolic blood pressure at a given intensity, especially at maximal intensity. But basically, we're not seeing the big changes at submaximal intensity. Also, looking specifically at our blood volume, our total blood volume can increase much more rapidly with training and make better adjustments. This is because our increases in plasma volume are going to also increase our plasma proteins and our water and sodium retention, especially in the first 2 weeks. This will kind of go away as our red blood cell volume and our hematocrit kind of learn to compensate, and we'll see a decrease in our plasma viscosity. So we can use the blood, it's much more efficient, less viscous, can get to things more easily. So here you can see VO2 max and the interaction of cardiac output. I do not know how much you guys know about statistics in this particular class at this moment, but usually we look for correlations. That is the R value. So the closer an R value is to 0, it is the less correlation, and the closer the R value is to 1, the stronger the correlation. So here we can see the correlation is 0.968. This is almost 1. This shows that there is a very strong correlation between somebody's maximal oxygen output, or VO2 max, and their cardiac output. So this is where we start flirting with the Fick equation again. Even though I can't directly measure it very easily, I can make some healthy assumptions. All right, here we can see an interaction between the VO2 max and our red blood cell volume. Not as strong of a correlation here. We would call this a moderate correlation. That's usually somewhere between 0.4 and 0.6. So we can, again, kind of make some assumptions that as somebody's VO2 max increases, we're also going to see some interactions with the red blood cell volume. All right, so we can also look at the actual pre-training and post-training blood composition. So we have the overall changes in the blood volume. So pre-training we had about 5 liters of blood, and post-training we have about 5.7. So again, we are making more blood because it has to get to the capillaries and the veins and get to all the working muscles as well as the skin. And then we see an actual increase in the number of red blood cells going from 2.2 liters to 2.4. However, when we have these big changes in volume in addition to red blood cells, our hematocrit percentages may change slightly, and we may even see a very slight decrease. So, moving away from the cardiovascular system, let's talk about the respiratory system. Major changes with aerobic training here. You are going to see a decrease in your pulmonary ventilation at a given submaximal intensity. So when I am doing an exercise, I do not have to breathe as heavily to make sure I'm adequately oxygenated. We'll also see an increase in pulmonary ventilation at maximal intensity because we're actually also increasing our tidal volume and our respiratory frequency. So we can actually oxygenate better when we get to our maximal efforts. In terms of pulmonary diffusion, we don't see a lot of changes at rest and submaximal intensity, but we do see big changes and increases at a maximal intensity because our lungs can actually perfuse oxygen much more efficiently. And then kind of circling back to that AVO2 difference, we are going to typically see a difference because oxygen is extracted much more efficiently to the active muscles requiring blood flow. And this is because we are, in general, increasing our oxidative capacity. All right, looking at our muscles. So remember, we are not actually changing muscle fiber types, but we're kind of changing characteristics. So as we increase the size and number of type 1 fibers, so we are taking these type 2 fibers and we're not actually changing them into type 1 fibers, but we're kind of giving them more type 1 fiber characteristics, which means I can take my type 2X fibers and have them perform more like a type 2A. This is where that kind of change is actually taking place. Capillaries will increase the number of capillaries, as we previously discussed with the cardiovascular section, and this may actually be the key factor to increasing our VO2 max. Myoglobin within the muscles, so you know we have hemoglobin going through the bloodstream. Myoglobin is what offloads the oxygen and carries it around the muscles. We're going to see a major increase in myoglobin content as high as 75 to 80%. Basically, this allows us to increase the oxidative capacity of the muscles. All right, we will also have improvements in our mitochondrial functioning, typically because the mitochondria are getting bigger and more numerous. Basically, though, if we want to change the number and size of mitochondria, I have to give you a very specific type of training at a very specific training volume. And then finally, our oxidative enzymes are going to increase with our training. And even though my VO2 max may plateau, this is still going to continue to change with training. So even though I may be training and I've gotten my VO2 as high as I possibly can, this can still come in and make us more efficient, particularly in sparing glycogen. All right, so this is a nice little summary slide looking at the mitochondria and the interactions there. All right, so percent changes in VO2 max. So we can see that the longer I train, I'm still going to get some very slight changes in VO2. We notice that the largest changes occur initially and early on in the training cycle. And then as we get later on, these changes are smaller and much more insignificant, but are still there. All right. However, we can see these really big changes that continue to be really big changes in that oxidative enzyme capacity. And this is why, even though my VO2 isn't changing significantly, I'm still getting big performance changes. All right, and then training distance. So because even though my VO2 isn't changing, because my enzyme activity is changing, I'm still getting this overall change in my training capacity. All right, so another way to look at this, these are succinate dehydrogenase. This is various intensities of physical activity. So if I do high levels of intensity, we tend to see the biggest changes, and then smaller levels of intensity tend to cause the smallest. All right, again, very similar pattern when we look at citrate synthase. All right, moving from cardiovascular and respiratory and muscular, let's talk about metabolic. All right, when we start looking at performance, we know one of our big limiting factors is our lactate threshold. Basically, this is kind of the ceiling for our top performance without starting to cause detriment. If you remember, this can be anywhere between 50 and 70% of somebody's VO2 max. So the cool thing is when we train, we can actually have a lactate threshold and delay it to later in our VO2 max. This is because we can either have a decrease in lactate production because we are much more efficient with our oxidative capacity, or we become much more efficient in clearing the lactate we are accumulating. Basically, when we can train our lactate thresholds, we are allowing ourselves to perform a higher intensity of physical activity without that detrimental lactate accumulation. And then again, we're still concerned with our respiratory exchange ratio. This tends to go down at both absolute and relative submaximal intensities. This means that even at higher intensities, I can still use fat and become less dependent on glucose. All right, so looking at our slides, we have our blood lactate concentrations, percentages of VO2 max, and then we have a trained and an untrained individual. So if you remember me saying, somewhere between like 50 and 70, sometimes as low as 40, we can achieve a lactate threshold. So if our untrained individual, we can see this happening at around somewhere between, I'm going to call it 58% of the VO2 max, and then this highly trained individual isn't occurring until 80%. So this means that when we look over here, so let's say they both max out at 100% of their VO2 max, an individual who is trained only accumulates around 10 millimoles of lactate, while an untrained individual is accumulating around 13. All right, we still see the same thing if I change it to general speed. You notice both of these individuals tap out at around 10 millimoles of lactate, but one of those occurs at about 19 kilometers per hour, and the other person taps out at like 14.5. Who's going to be the better performer here? Most likely the individual that could tolerate around 19 kilometers per hour as opposed to the other one who could only tolerate about 14.5. All right. Also metabolically, looking at our resting and our submaximal VO2s, our resting VO2 is pretty much unchanged with training, as well as our submaximal VO2, or we may see a very, very slight decrease. However, our maximal VO2 tends to increase substantially with training. We can get these big changes around 15 to 20%. And again, this is mostly because we're seeing an increase in our cardiac output and our capillary density, as well as our oxidative capacity. So this is a very lovely summary slide. This is one of those slides, if I were to take a test, I would put a big old star and feel very comfortable looking at this. Hint, hint, wink, wink, pay attention to this slide. All right, so still on the metabolic, long-term improvement. Your highest possible VO2 max, if you were intentionally trying to improve that, is going to be achieved after somewhere between 12 and 18 months of training. Basically, any performance increases after this VO2 plateau is because of improvements in lactate threshold that is going to continue with training. Factors that are going to kind of dictate our individual responses to metabolic factors and improving performance are pretty much going to be your training status. So were you fairly active to begin with, or were you very sedentary? Your pre-training VO2 max, and then just general genetics. Do you have the genetic capacity to be good at endurance? All right. So looking at this example here, we have oxygen uptake of VO2 on the left and the absolute velocity on the bottom. So if we look at this line right here, this is a performance line. So at about 75% of VO2, that is going to be 53.3 mLs per kg per minute. This puts that individual at, we'll call it 15.5 kilometers per hour. If we can push them to 88% or 62.5, this puts them at around 17.5 kilometers per hour. So remember lactate threshold. This is going to be an interaction. If somebody can tolerate 75% of their VO2 max, but I can push them to tolerate 88%, we're going to have better performance. All right, so digging into these a little bit more, training status and pre-training VO2, your relative improvement is going to be dependent on fitness. So if you're already a super fit individual, it is going to be much more difficult to see improvements in VO2 as opposed to somebody that's going from a couch potato to trying to do any level of physical activity. So when we are dealing with more sedentary individuals we're going to see greater changes, and then more fit individuals are going to be much more insignificant changes. Also, genetically, everybody has a finite VO2 max range. It does not matter how hard you train these people, everybody has a genetic ceiling. We have done studies on this, looking at identical versus fraternal twins. So identical twins are obviously genetically identical, and fraternal twins, even though they are born at the same time, are truly siblings and have their own unique genetic components. We have noticed this, and we've done the studies here, that the VO2 max is going to be more similar for individuals who are identical twins, so genetically the same, as opposed to fraternal twins, which are not genetically the same. This kind of supports the fact that everybody has a genetic ceiling. We can account for the variation in VO2 max to be somewhere between 25 and 50% due to genetics. So, for example, someone like me, who really is not a distance or endurance athlete by any means, a lot of that is just due to genetics compared to somebody who, say, is a distance runner. All right, so again, this is one of the twin studies that we looked at. So kind of what this means, a monozygous twin is an identical twin where you started with one zygote that split into two. Dizygous twins, these are fraternal twins. So two different zygotes, even though they're born at the same time, and then non-twin brothers. So we could see that there is a correlation between genetics of the family, but things are the most similar. So the ones that are closer to the line with the monozygous twins, and then we deviate further between dizygous twins and non-twin brothers. All right, so other things to consider, males versus females. So an untrained female's VO2 max is going to be lower than an untrained male VO2 max. And then, but when we go through training, females tend to be closer to males when they both go through training. A lot of this has to do with hormones and active metabolic muscle versus body composition. But again, you can train men and women exactly the same in terms of improving VO2 maxes. They can tolerate the same levels of training, and we can actually train them to be fairly similar. We also have individuals, when we do metabolic training to improve VO2, that are going to be high responders or low responders. Again, this is genetically determined. So this is another variation of VO2. So I could put two people through the exact same training protocol. They could both follow it beautifully, identically, to the T, and you're still going to get two different responses. All right. A lot of this is due to the genetic components of our physiological mechanisms, like our cardiac output, blood volume, and O2 extraction. And this, again, is why we have tremendous variations in training outcomes. This is why, if you are interested in coaching or sports performance, coaching is both an art and a science. Just because I've written a beautiful training program and it works for one person doesn't necessarily mean it's going to work the exact same for somebody else. All right, so this is an example of this genetic component and the changes. So we have the VO2 max response and families ranked by the mean value of the family. So basically what we're seeing here, they received the same training protocol. Our baseline was trying to get a change of about 400, and even though every single individual did the exact same thing, there was a wide variety in changes. All right. So kind of the next thing to discuss after talking about cardiovascular, respiratory, metabolic, and other adaptations is fatigue. When you are performing a sport, Fatigue is what is going to make or break win games, competitions, performances. So if you're competing in an endurance-based event, endurance training is going to be essential. Also, even if you're doing a non-endurance training-based sport, you do need to have some level of general fitness to help you perform your sport better, right? So across the line, all athletes are going to benefit from some level of endurance training and trying to maximize their cardiorespiratory endurance. All right. When we go on the flip side of this, so I am getting out of shape or aerobic deconditioning. Typically, this is because somebody has ceased activity. The most extreme version of this being put on bed rest. Usually, if somebody is put on bed rest, they're stricken with some sort of disease or disability. We also do studies like this for weightlessness in space travel. Basically, what we're going to see when you are put on bed rest is we're going to see changes, typically declines in body weight and lean body mass, and significant loss of cardiovascular fitness. This loss tends to be greater if your VO2 max was higher at the start of bed rest or weightlessness. So the more fit you are, if you start with a very high fitness and go right into bed rest, you have a lot more to lose than somebody who, say, was only at a moderate fitness and then goes on to bed rest. So, final topic that I'd like to discuss is anaerobic training. All right, we're going to have changes in anaerobic power and capacity when we go through training. Typically, we assess this with the Wingate anaerobic test as kind of our gold standard. However, you've heard me speak about this test before. It involves using a very particular type of cycle. It is incredibly fatiguing. Lots of people vomit when they're done, which gets kind of messy and gross. Even though it's the gold standard, we have lots of different ways to assess this. Basically, we're just trying to ensure that anaerobic power and capacity increase with training. What the muscles are going to do, so we tend to see an increase in our type 2 fibers, particularly type 2A, type 2X, will increase their cross-sectional area. You'll also see an increase in type 1 fiber cross-sectional area, although this is much less significant. And then we start to see not the true transition, but the changes in characteristics, where we have changes in the percentage of type 1 characteristic fibers and kind of an increase in our type 2 characteristic fibers. Also, with anaerobic training, looking at the ATPPCR system, we're not having a ton of enzymic change here with training, but if we are doing specific ATP-PCR system training, we tend to have increases in strength. So even though the sheer amount of ATP-PCR does not necessarily change, if I do this specific type of training, I tend to see increases in strength. Also looking at our glycolytic system, basically when we train, we tend to increase the activity of this system. But again, those performance gains are not necessarily because we're getting more enzymes. It's because we are actually increasing strength. All right. So looking here, this is percent changes in enzyme activity. So here we have trained and untrained. So we notice that with creatine kinase, you have these big increases. All right, here we also have mean power output and maximal knee extension time. So we can see with training, this individual can produce more power for the same period of time as opposed to this individual, which was producing less power over the same period of time. All right, so the most common type of training for kind of hitting some anaerobic and aerobic concepts is HIIT training or high intensity interval training. This is kind of the best bang for your buck physical activity because it's very time efficient and I can introduce lots of adaptations for endurance training through anaerobic training. basically what ends up happening is we have mitochondrial enzyme cytochrome oxidase, which will increase the same after HIIT training as traditional moderate intensity endurance training. So if it comes down to, can you go do 45 minutes of cardio, or you can do a 20-minute HIIT session, most people will go do the 20-minute HIIT session and get the same results. All right. So after the brief aside of HIIT training, when do you train specifically and when do you cross train? All right. So if I can make my training as specific as possible, we tend to see improvements in VO2 max that are substantially higher in that athlete's sport. And this is because we're having individual muscle group adaptations. All right, so that means if I want a runner to become more efficient at running and improve the cardiovascular system, I should probably go have them run. However, if you keep having individuals do the same thing over and over and over again, even though it's going to cause the most specific changes, we can also increase the risk of injury. So this is where cross-training comes in. So this is using training that is going to activate a different fitness component once or more than once in a sport. Basically, any strength benefits from cross-training are kind of blunted by endurance training. So this is specifically like asking a power lifter to also go run. I'm going to kind of deactivate some of their strength gains. However, on the flip side, if I ask a distance runner to go lift, you're not going to see as big of a problem going between the two. So strength benefits are blunted by endurance training. Endurance benefits are not blunted by strength training. So this is a big deal. I would put a star by that. All right. So cross training can be something as simple as switching up your modality. So asking a runner to go swimming or a swimmer to go running, just to work on something a little different. Or this could be a combination of endurance training and strength training. All right. So looking here, you're looking at the differences between a VO2 max acquired from the sport-specific activity and the VO2 max acquired from an uphill treadmill run. All right. So if we look at here, like the ideal situation, you have a male skier and an uphill treadmill run. All right. Those are very similar to each other. You almost notice that they acquire almost identical VO2 maxes. However, let's say you have a cyclist and then you ask them to run. These are not as similar. All right, so we can see here when they were doing their sport-specific activity, their VO2 was around a 75. When we asked them to run, it was lower at, like, say, a 72. All right, so there's a time and a place for specificity and a time and a place for cross-training. All right, so with that all said, this is a nice summary slide of about the last 10 slides that I have talked about and kind of their importance with specific training. So again, I hope you guys enjoy your spring break. Have fun, relax, take a moment to woo-saw, and just enjoy having some mental space. And I look forward to seeing you guys all again on Tuesday. Bye.